very tough decision when that time comes with your mother or father. I always wanted to be able to say, hey, I can take care of you no matter what. Having to go through it, I couldn't ask for a better facility, better employees, better staff to make that event the most bearable and the most satisfying.
We are a skilled nursing facility. We take care of older residents for the most part that need to have medical help 24 hours a day.
The Tuscola County Medical Care differentiates from other medical care facilities in my mind as far as striving to be the best of the best. We always are trying to lead by example within the skilled nursing world.
The mission is to be a partner in the continuum of someone's life. So whatever that means to that situation, it might mean getting them better and going back home, or it might mean providing care until their last days.
Our mission when we get a new patient in is to make them feel respected and maintain their dignity.
The sense of community at our facility is highly important. We not only provide care and enrich their lives, we become like a family here, building relationships.
We just changed that piece of our name a couple years ago, and we did it because it used to be the word facility, which is a very institutional type name, and we wanted to sound warmer, and community does that because we really are a community. We all live here together.
I was very pleasantly surprised with the hominess of the facility and the great quality care she got while she was here. Physical therapist, occupational therapist, the nurse staff, the nurses' assistants, I mean, just make you feel welcome, make you feel part of the family here.
The relationships that are built here between me and myself, my coworkers, and the residents they're long lasting in my mind, and they're more like family style, family driven relationships versus just, hey, Mr. So-and-so, I'm here to do X, Y, and Z, I'll see you later.
The rooms are nice and the people are very attentive to everything that you might need or want, and it just has a homey atmosphere.
Well, they've been excellent with treating us, They've done everything that they could to do to help us.
Well, I'm always happy when I hear a family or a resident or a visitor say how much they enjoyed coming here, or how clean it is, how good the staff is.
They do pretty much everything well. I've been in other facilities, everything from the medical staff to kitchen staff. It's always clean, warm, comfortable in here.
Just the accessibility of them and the willingness to make the stay at this facility for my mother the best it could be. It was amazing.
Rooms are nice, the grounds are nice. It's a nice place to come, even as a rest home.
I have a very high level of trust for these people. They're very concerned about everything, and they're always here to help you.
We expect a lot from our employees, but they give a lot, and I never worry about, when I'm not here, I don't worry about it because I have a strong, trustworthy staff that will always be good to residents.
I think our interdisciplinary team approach is second to none. We really work well together with all the different departments.
I would say the highest levels of professionalism, regardless of who I've been dealing with, whether in billing or social workers, physical therapists, dietitians, just about everybody. They keep me informed, and then I keep the rest of my family informed about what's going on.
When I think of community here, I think of nursing reaches out to dietary reaches out to social work. Oh, hold up, we gotta talk to billing about a situation in therapy. Everybody's involved, and that's what makes it so successful to promote residents' care to the highest functioning level.
Several years ago, the Centers for Medicare and Medicaid, which are our paying sources, came out with a 5-star ranking of nursing homes. And so it's based on quality measures, quality of life, quality of care, that achieves that. And we did achieve that over 4 years ago, and we've sustained it for all this time. So it's not only making that mark, it's the sustainability.
Well, we recently built 2 small houses, we call them, but they're absolutely not small. They're 10,000 square feet each. But that's to move us into the person-centered care era. And that means instead of us having rules to follow, the residents set the rules the way they want their care delivered. Now the houses are done, and we would like to build 4 more of those houses. And then we recently purchased some land. So we're thinking about perhaps an adult daycare center, and then perhaps independent living and assisted living, which would then be the full continuum of care for elders.
One of the ways that people can get involved with our facility is to get involved with our foundation. Our foundation is just young and in its infancy, really. So bringing in money to help do and build new things, to sustain the level of care that we provide all the time.
They're expanding because they want to care for more people. It's just, it could only get bigger and better.
There's, I don't think, ever an end to things you can do to better your organization or make life better for elders.
The door for communication is wide open, and it's all about making things better here. It's never just, we're good where we're at and let's just settle.
This would be the only place I'd recommend to try to get their family member housed, somewhere where it is safe. And if I ever get that old, I want to come here.
Again, the welcome attitude, the welcome atmosphere, environment that this place has is just, it's phenomenal.
He's getting good care. And that is what is utmost important to us.
If you love the elderly, this is the place to be.